Good evening. With one confirmed case of measles in Lloydminster and health officials investigating 3 other possible cases, the Prairie North Health Region is looking at ways to handle the outbreak. CEO David Fan says they are taking steps to deal with the situation. He adds if you have an unimmunized child, that you should take them to the clinic.
Parents and families to get their children immunized, and because that's, in the long term, that's likely the only way that will provide protection for everyone.
Fan says this is a unique case for our region, as they haven't seen an outbreak like this in the past 20 years.
Sending alarm bells through the system. It means that we need to step up, providing a certain level of protections, and that the best way to do it is provide immunization.
He adds they will be setting up more vaccination clinics as soon as possible. Now, if you have any questions, you're asked to visit your doctor or call the health line at 811. Meanwhile, with the measles outbreak in Alberta, residents in the Lakeland are making sure they are protected. An immunization clinic is being held this week in Bonnyville for adults and children to get their shots. And as Frazer Snowdon finds out, you may need to check when you last got your shot.
So left arm is fine with you?
Oh, yeah. The clinic saw more than 30 people throughout the afternoon, giving out different shots. This included Alana Kissel, who brought her 1-year-old Andrew to get a measles immunization.
Very important, as it's kind of that herd immunization, because there is certain people of the population that can't have those vaccines for health reasons, allergies, and the age factor. So my little child, 6 to 12, he's under 12 months, he's not immunized, so he can't be immunized till a little bit older. So those puts those populations at huge risk.
Alberta Health says there is no scare of measles in the North Zone yet, but it doesn't hurt to play it safe.
People travel frequently these days. We're pretty mobile as a whole. Being that measles is so contagious, I mean, it's circulating, we know that.
Officials say to protect the vulnerable from the measles, even if you had the shot when you were younger, you may need to get a second dose, which happens to be my case.
First shot will offer some protection, but of course with the immune system you want to make sure that it's as primed as ready as possible. 2 doses of measles vaccine has proven to be the most effective.
Leah Synowec works in healthcare and says it's amazing to see how many people choose not to vaccinate their kids.
I'm not sure why that is, but we're starting to see problems arising because of the fact that people have chosen not to vaccinate their kids.
Alberta Health says vaccines are very safe.
They go through a rigorous testing process before they come to market, as well as an ongoing safety screening and monitoring program even after they're on the market.
If you would like more information about clinics being held, visit the AHS website. In Bonnyville, Frazer Snowdon, Newcap News.
Well, as we first told you yesterday, fighting infection may now be harder. This according to a report from the World Health Organization. Antibiotic resistance has been an ongoing issue, but now it's calling on health professionals and the public to take action to stop this problem. Anna Snazlow has more in this week's Healthy Living.
When we are most vulnerable and in need of these medicines, there is a chance that they are simply not going to be available.
A statement that isn't surprising for pharmacist Justin Agarwal. He's been running Remedies Pharmacy for the past 10 years, and he says antibiotic resistance isn't new.
Penicillin was invented in 1928. The last class of antibiotics, the new class of antibiotics, was about 30 years ago. So we haven't had a new class of antibiotics in about 30 years.
The report focused on 7 different types of bacteria that causes the most common but serious diseases like urinary tract infections, diarrhea, and pneumonia. And officials say the resistance is high when it comes to treating these diseases.
For this resident, it's alarming. As a diabetic and someone who's lost a kidney, Ron James is one of the many people who may be affected.
I still have to take 6 or 7 pills a day, so basically what you're saying to me is that if this is broken down any worse than what it is, well, it would affect somebody like me more than it would somebody that don't have the same problems.
Agarwal believes a big part of the resistance comes from the patient wanting a prescription without really needing it. His advice is to listen to your doctor and follow directions on the prescribed medicine.
They'll come to the pharmacy and say, the doctor gave me an antibiotic, but I want to get this just in case. And we'll say, you know what, wait that 24 hours, 48 hours, whatever it may be, because it may clear up on its own.
He adds the rate of common diseases are not only climbing in many third world countries, but in Canada as well.
When we do see a prescription for an antibiotic, it's our duty to make sure that that antibiotic is the right choice for that particular infection, and not only that, that it's the right dose.
The WHO says preventing infections in the first place will reduce the need for antibiotics. Some of these methods include better hygiene, vaccination, and tighter infection control. Anna Stanislaw, Newcap News.
The County of Vermilion River has issued a partial fire ban. Now, due to dry conditions, the ban is now in place within the boundaries of the county. Only recreational incinerator fires are permitted, and they must be contained, supervised, and fully extinguished upon completion. All other fires are banned, and all previously issued permits are canceled for the duration of the fire ban. Now, if you do not comply, you could face a $500 fine.